My name's Brunet. I'm a forensic psychiatrist at the East Coast Forensic Hospital, which is in Burnside in Dartmouth. And what we do here is we assess individuals who are sent by the courts for court-ordered psychiatric assessments after they've gotten into some kind of trouble with the law. And we also do treatment of individuals who are in the correctional facility next door who might need inpatient psychiatric treatment. And for those individuals who are assessed as being either unfit to stand trial or not criminally responsible due to mental disorder for their offenses, we provide them ongoing treatment and rehabilitation in a separate part of our facility. So the type of patients that we see here are often those who have had some previous contact with the mental health system, and who for a variety of reasons have not been well served by the mental health system due to either themselves not being interested in receiving help, or there not being enough bed space in the general mental health system, or people having to be released early even though they're still unwell, and then they subsequently are in the community and get into some type of trouble. So that's one of the unfortunate things about what can happen to people, because they're not able to get some of the services that they need, and ultimately that can lead to frustration and desperation from the community or their family members, who resort to charging them or having them charged, even if it's for a minor offense, because of the belief that that might be a way to get the person help. And a relatively recent example of someone like that who I saw was a person who lived in another community who was homeless for a combination of choice, but also because of suffering from a mental illness, caused this person to have behaviors that other people found problematic, and the available accommodation, which was limited in that person's community, weren't able or willing to tolerate having that person in their facility, loud, noisy, maybe argumentative. The person was fairly obviously mentally ill to everybody around them, but refused mental health intervention, couldn't be taken into care because they weren't in active danger to themselves or others, even though clearly not able to take care of themselves because of living essentially on the street in wintertime. So for this person's case, the general public was aware the person was mentally ill, police were aware the person was mentally ill, community services were aware that the person was mentally ill, but because of the limitations of the way our system is set up and the person's unwillingness to engage, help could not be provided, and the person was living on the street and at times choosing to live in the lobbies of banks, public businesses. And that caused the general public some concern, because the person would be occupying the space, was somewhat cranky at times, getting in the way, interfering with the business conducting itself, and at times, due to the fact that it was freezing cold, winter, middle of the night, would unfortunately choose to use the bathroom in that general area and in the bank lobby. And this happened in a series of settings, with, again, everybody being fairly well aware that this person needed help and was ill, but there being no clear mechanisms as how to provide that they decided in a general consensus to charge this person with a variety of counts of mischief based on their behavior. So, this was a person who unfortunately was very obviously mentally ill and in need of a wide variety of services, but only ultimately was able to obtain them by having been criminalized and charged with a number of minor offenses that someone in the general public wouldn't even get jail time for. But because of the way our system works and the court system works, once someone enters it, the person was institutionalized in our facility for several months. At the end of the day, the person received treatment and assistance with getting some elements of their life organized. Follow-up arrangements were put in place at the end, and a place for them to live and regular financial support was arranged. But this was probably 6 months, 7 months after the person was first seen to be living in a bank lobby in February, and apparently ill. And in the course of that 6 or 7 months, the person had multiple trips back and forth to court, and spent a fair amount of that time without any access to the community and without any freedom. So at the end of the day, she benefited, but the process by which that benefit was provided was extremely expensive, very restrictive, resulted in a criminal record to the person, and likely was probably not necessary in the first place had we had a better ability to deliver services to people who have complicated but obvious needs.